to Candid Convos with Nurse E. I am so happy to be back and talking with you guys about something that I want you to stop. Yes, you heard me correctly. I want you guys to stop doing this. And I know you're like, Nurse E, what is it that you want us to stop doing? I want y'all to stop going to the emergency room. Let me say it a little bit louder for the people that's in the back. Stop going to the emergency room. You're like, Nurse E, that is like super duper random. Like, why do you want me to stop doing that? Because you're not getting the care that you need and that you deserve. Now, before I get into this, let me take a sip of the piping tea before I give you the tea. Okay? This is green tea today. It's so good, you guys. Y'all see my mug? I absolutely love it. Someone gave it to me. And I can't remember who, but I thank them for it. I absolutely love it. So why am I telling you guys to stop going to the emergency room? I'm telling you this because earlier this week I was speaking with a friend and they weren't able to come to work. And so I was checking in with them and I'm like, hey, you know, what's going on? Why are you not here at work? And they shared with me that they had gone to the emergency room and that they weren't feeling well. And so, of course, I'm inquiring about why they went to the emergency room. And, you know, I won't disclose what it was, but it wasn't something where it was an emergency. I know when you're in pain. I know when you don't feel well. I know when things just don't seem right. You're like, oh my gosh, I need to get this fixed and I need to get this fixed right now. And so the best place for me to go is to the emergency room because they're going to fix it right now. But let's be honest. How often have you gone to the emergency room with a complaint, with a problem? They've given you, maybe they've done some tests, maybe an x-ray, an MRI, a CT scan. They've had a provider come in and talk with you. They wrote you a prescription for some medication and or referred you to go and see your primary care provider. And that was pretty much it. I think sometimes that happens more often than them admitting you for whatever it is that you're going in to see them for. So my whole point in having this conversation with you is to help you understand when it's appropriate to go to the emergency room, when it's appropriate to go to the urgent care, and when it's appropriate for you to go and see your primary care provider. Now, which end should I hit first? Let's go ahead on and talk about not going to the emergency room or when to go to the emergency room. When to go to the emergency room, this is a loaded question and it's an extensive list, but I'm going to try to make it as concise and with a bow. Something nice and easy for you to understand. Now, you're going to go to the emergency room. Let's start from the head all the way and we'll go down to the bottom, to the feet, okay? If you have a headache that is unrelenting, a migraine, there is some type of head pain, some type of vision loss, some type of hearing loss, all of a sudden you can't smell, all of a sudden you can't taste, your words are slurred, or you can't communicate at all. Reason I say this is because you could potentially be having a stroke. And so if you are experiencing some of those symptoms, slurred speech, can't see out of both eyes or one eye, a headache that is unrelenting, like you need to go to the emergency room because you could potentially be having a stroke and you don't know it or you're unaware, okay? Another time that you should go to the emergency room because it's an emergency is you cannot breathe. You can't inhale. You can't exhale. You are having distress breathing. The chest is caving in. Air feels trapped. You're wheezing. You're gasping. anything like that where it's just difficult for you to breathe, you need to go to the emergency room. This could be a lung issue like a pneumonia, a severe bronchitis, something in relation to that, and or it could be a heart attack. It could be heart failure. It could be something going on with the lungs and the heart at the same time. So you definitely need to go to the emergency room if that is the case. If you have chest pain where it feels heavy, there's no relief. You take antacids, there's no relief. You take an aspirin, there's no relief. You need to go to the emergency room because you could be having a heart attack. If you have chest pain and the pain is radiating down the left arm, this is specifically seen in males. That could be a sign that you're having a heart attack. Women, not so much. We could have issues with breathing. We may have some slight chest pain. We may have abdominal pain. That can be an indication that we're having a heart attack. And that would be a time where you would go to the emergency room, you guys. Okay? Any type of abdominal pain, especially down here in this right quadrant, it could be your appendix. We don't want that to rupture. For women, it can be your ovaries. It could be some type of cyst. It could be some type of fibroid flare up. Those types of things you need to go to the emergency room for. So abdominal pain that just will not go away, and you've done interventions that you would do, like if you had an issue with like gas or something like that, and it's not working, it's unrelenting pain that brings you to tears, you need to go and be seen in the emergency room. Now, if you fall and you hear a crack and or pop, and your extremity looks disfigured, whether it's your arm or it's your leg or it's your knee or it's your foot, guess what? You got it. You need to go to the emergency room. This is an emergency. A broken bone is an emergency. Where something looks disfigured, not just swollen or difficult to walk on, that may not necessarily be a broken bone. But if something looks disfigured, we need to go to the emergency room, you guys. So those are some examples of when to go to the emergency room. And if you need further clarification on whether or not a situation warrants you going to the emergency room before it happens, drop it in the comments. Let me know, hey, Nurse E, I have this going on, or what if, a hypothetical. Ask me, I'll let you know. Hey, go to the emergency room, or you may need to take a trip someplace else, okay? Now, let me see if I can think of any other time where you need to go to the emergency room. We talked about stroke. We talked about heart attack. We talked about difficulty breathing. We talked about broken bones. We talked about severe pain that is unrelenting. This is pain anywhere, you guys. Neck pain, back pain, shoulder pain, any type of pain where you take some type of medication and it doesn't go away. If you do ice or heat and it doesn't go away, definitely go and see what else is going on. Because the fascinating thing with the body is that there could be a number of things going on, and they can present themselves in ways where you think something else is going on. So, a woman may not have chest pain having a heart attack, but she may just have this vague arm pain or vague abdominal pain, and so I would rather you go to the emergency room and get a cardiac workup done than not go at all. You know what I mean? Because it's like, it's just an arm pain. Let me just take some medicine and see what happens. And if it doesn't go away, it can lead to death. So I want to make sure that I'm being very, very clear with when to go and when not to go. Pain that doesn't go away, go to the emergency room. Go to the emergency room, okay? If you take something and the pain goes away, now we can go into another direction. So I think I've covered a lot of things and given some clarity on when to go to the emergency room. Now I want to clarify when it would be best for you to go to the urgent care. Let's say that you had a minor fender bender, okay? You can go to the urgent care, you can be seen, you can get some x-rays. They'll assess you on whether or not you've had a strain or a sprain. Get some x-rays, get an MRI, get some type of scan, diagnostic testing done. And then they can direct you on whether you need to go to the emergency room or follow up with your primary care provider. So something kind of like that. If you've had a headache for, a couple of days and you've taken medication and it's gone away, and you realize that it's like related to stress, or when you get in certain environments, certain smells, different things like that, you can also be seen at the urgent care if your primary care provider is not available. But urgent means that it's not a life or death situation, but it's important enough to be seen by a provider to have the issue addressed. If you have fallen and you're not sure if you broke anything, it doesn't look disfigured, you always can go to your urgent care as well. Urgent cares are more so for if it's not as important for you to be in the emergency room, and or your primary care provider hours are not available. Okay, that's the place that's in between. That's a place where you can be seen rather quickly and efficiently, because they don't have this massive amount of people in there like the emergency room would have, okay? So going to urgent care is an option when you want to get in quickly and possibly get out quickly. So that's when you want to go to the urgent care. If you were cooking and you cut your hand, you could go to the urgent care. They have the capability of suturing things up and sending you on your way, giving you antibiotics if you need it, giving you pain medication if you need it. It's something that is urgent, but it's not an emergency. Does that make sense what I'm saying? If you need further clarification on that, again, leave a comment and I will get back with you and let you know, hey, this is when you need to see urgent care and this is when you need to go to the emergency room, okay? Let's talk about kids, because kids usually have incidences where they may need to be seen and seen quickly. So depending on what's going on with them, again, if it's some type of fall and they have bruised themselves or developed a wound, this is something that can be handled at the urgent care. They can be seen quickly and can be treated and, be able to go home the same day. The reason I bring this up is because we could spend a lot of time in the emergency room for things that can be addressed quickly and things that can be, I guess what I really want to say is that we're wasting precious time and we're wasting time on the type of care that we need. If we go to the right place, then we can get care pretty swiftly. If we go to the wrong place, our needs are not going to be met, and then we're going to be frustrated. We're going to be frustrated with the time that we've waited. And then when we actually see a provider, we're like, this was all you were going to do? Yeah, because you could have been seen someplace else and got that done quicker someplace else. So the reason for this talk is because I want you to get the care that you need. But you can only get the care that you need going to the specific place that can give you that type of one-on-one TLC care. Does that make sense? Okay. So urgent cares are good for something that is urgent, like a fall, a motor vehicle accident, some type of freak accident. You know what I'm saying? You cut yourself while you're cooking. Something happens with the lawnmower, something that is urgent, but it's not an emergency. Now, trust and believe, if it's something that the urgent care cannot handle, they will send you over to the emergency room. And if it's something that the urgent care cannot follow up with, they will send you to your primary care. So urgent care is a good middle ground to delegate whether you need to go to the emergency room or you need to be seen by your primary care provider. Okay? Does that make sense? Now, let's talk about when you need to see your primary care provider. First, if you don't have a primary care provider, and that is the reason why you go to the urgent care or the emergency room, we need to address that. You need to have a primary care provider. A primary care provider is essentially like the captain of your health care. So when you have an issue, you go and see your primary care provider, and your primary care provider, if they can't treat it, they will send you to different providers that can help you. It's like they run the show. You understand what I'm saying? So if you do not have a primary care provider, you need to check with your insurance. They usually have a list of providers that are in your network that you can work with, and go and interview them and see which one is good for you. See which ones you mesh well with, and spend some time with them, talk with them, have a consultation with them, see if you can collaborate together, and then choose which primary care provider you want to work with. But you need to have a primary care provider. Okay. Once you have your primary care provider and you understand their role in your healthcare, then you'll know, hey, when I have a cold, or when I feel like I have the flu, or you might have COVID, you can go and see your primary care provider instead of going to the urgent care and the emergency room. Even if you have fallen, anything that's going on with you, unless it's like I said before, something where you're having unrelenting pain in the head, loss of vision, cannot speak, automatic loss of hearing, difficulty breathing, chest pain, those times you want to go to the emergency room, you will not go to your primary care provider. But if you think your child has a earache, or your child has fallen and you don't see any signs and symptoms of broken bones, or just anything that is not an emergency or urgent, you need to follow up with your primary care provider, because your primary care provider can handle it. One thing that you want to make sure when you are interviewing or deciding on what primary care provider you want to work with is, do they have open times in their day for walk-ins? I think that that's a big reason why people, go to the urgent care or to the emergency room, because they know they can just walk in and somebody is going to see them. In a primary care setting, not so much. But primary care providers should have slots of time where their patients can call in and say, hey, this happened to me. Am I able to come and see you today? If so, what time? Okay. You want to, if it's not an emergency and it's not urgent, you always want to go and see your primary care provider. If it's not life-threatening, you guys, if it's something that you've been dealing with for 1 or 2 days and you feel like you need some extra support, go and see your primary care provider. Your primary care provider should always be the first person that pops in your mind if you are sick, if someone that you love is sick, if your child is sick, and you've done all the things that you can to help them get better and it's not working, your first person that you should think about is your primary care provider, okay? If your primary care provider sees you and they're not able to help you in the capacity in which you need to be helped in, they will always refer you to the emergency room or to another provider to give you the care that you need. But I just want to put in perspective that The emergency room doesn't have all of the answers. And I want you guys to stop running there and waiting there for hours when another provider at another type of facility, either the urgent care or your primary care provider, can help you with whatever it is that you have going on. And if you are ever unsure, all you got to do is ask a question. I love questions. I will clear the questions up for you. Even if you don't ask me, don't ask Dr. Google, okay? Don't ask Dr. Google. If you have a healthcare provider friend, reach out to them. Ask them, hey, I have this going on. Should I go see my primary care provider? Should I go to the urgent care? Should I go to the emergency room? I hope that this video was so helpful to you guys. Again, if you have any questions, you can always leave a comment and I will get back to you. Hey, remember that you were fearfully and wonderfully made. You were created for a purpose and there is a plan that is attached to your life. I hope that in today's session, you realize that you have purpose. And the purpose is go see your primary care provider. Or get one. But aside from that, we love you so much and we're so thankful for you. Be great, move in purpose.